Hi, welcome to Therapy Playground. I'm Leah.
And I'm Kelly.
And today we're going to talk to you about childhood apraxia. So first we're going to start off with just a basic definition of what childhood apraxia is. So Kelly, would you give us one?
Sure. Apraxia is a motor speech coordination disorder that results in a child not being able to coordinate their oral musculature to create words.
Okay, very good. So here at Therapy Playground, the treatment approach that we like to use when treating kids with apraxia is Nancy Kaufman's treatment approach with the Kaufman cards. So Kelly's going to give us an example of what the Kaufman cards look like and the kind of therapy that we use when starting with them.
This is what the front of a card looks like. This is our card for bubbles, obviously. And on the back of each card, the word is broken down, and it's a bottom-up approach, so you can look at the card and see that if a child can't say the word bubble, which takes a lot of quick, fast movements and tongue movements, that they can start with the word buh. This also teaches the parent the bottom-up approach, so they can take the word from saying buh to get a bubble to bu-oh, then bu-bo, bu-bo, bubble, when they're able to do the L movement. So each time we use these cards, all of the cards are marked on the back, so it helps not only the therapist but to train the parents as well, and the parents can receive copies to go home if that's the word that they're working on for the week, so that they can practice it at home.
Yep. And then Nancy also breaks it down into very, very good steps for us to follow. She starts with vowel consonants and then consonant vowels and then builds up from there on. Kelly, I don't know about you, but every time I start with kids with apraxia, my parents, one of their main concerns is how long is this going to take? Like they bring this 2-year-old in and they're completely unintelligible. They can't understand anything they're saying to them, and they're wanting this quick fix. And so we show them this and we walk them through the steps and we're like, this is how we're going to work on it. This is what we need you to work on. Try not to push it. If all they're saying is bu-oh, we're accepting bu-oh as the correct answer. Right. And so, that's one of the things I face with them all the time is how long is this going to take? So tell me how do you deal with that?
Typically when I have a child that comes in and I do diagnose with apraxia, the younger they are, the longer it's going to take, obviously, because the Kaufman approach is a very structured approach. It takes a long time, but I will normally tell a parent, this is a long haul. Mm-hmm. This is not going to be you're in and out in a 2 or 3 month time period. This is going to be a child that's going to be in therapy for probably most of their school age years, mm-hmm. to include high school. There have been children that I've worked with that have made it all the way to middle school and they're very intelligible, but they still need to work on multi-syllabic words because they're not able to say maybe the Pledge of Allegiance or something like that in a quick and fast manner. So
right.
Things that they have to do at school, which are going to be standing up and giving reports in the high school, they're still going to need some support and some help to get there. So I typically tell them that it's a long haul.
Yep, I agree. And then, we also here at Therapy Playground do a bunch of home visits. And a lot of our home visits are also kids that have apraxia. And that's probably our hardest environment I feel that we work with because these are kids that we have absolutely no structure with.
Right.
We're in their environment, they're running around, they're playing. And, Nancy Kaufman will explain that it is very, repetitive. You have to, you drill, you take a break. You drill, you take a break. So like you said, the younger they are, it's more difficult for us. But however, we want them in therapy real young so we can get them started and get them in that routine. But yeah, I agree. So, if you have any other questions about apraxia or our treatment approach that we like to use, you can give us a call up at Therapy Playground or you can visit our website. Thank you very much for your time.
Bye-bye.